The World Health Organization has declared a new outbreak of Ebola a public health emergency in the Democratic Republic of Congo and in Uganda. This after more than 300 suspected cases and 88 deaths. The top global health body warning that the outbreak is of international concern, but says it does not meet the criteria for a pandemic. Well, I'm pleased to welcome to the programme now Trish Newport. She is working on the Ebola response for Doctors Without Borders as she joins us now from Geneva. Hello to you and thanks for speaking to us here on the programme.
Thanks for having me.
Look, I understand that in 2018, during the serious Ebola outbreak in the same region, you worked on an experimental vaccine to combat the disease. So can you just tell us then a bit about what you were doing then and what lessons we can draw from 2018 related to this current crisis?
So in 2018-2019, one of the key lessons, which is a lesson in every single Ebola outbreak that we've had, is it's key to engage with the community. We can't just be coming into an area and saying Ebola is the priority and this is what we need to be focusing on. Yes, we need to be working on the Ebola response. We need to be cutting the chains of transmission, but we can't do that without the engagement of the community. Another key lesson that comes up every single time there's an outbreak is that we have to ensure the populations still have access to healthcare, that we're still able to respond to other outbreaks that are happening. In Ituri today, MSF already has 5 big projects responding to displacement, ensuring access to healthcare, responding to conflict. We're consistently responding with the Ministry of Health to respond to other outbreaks, like for measles. And so this, we have to ensure that even if we're responding to Ebola, which is what we're planning to do, and we have teams on the ground to do that, we also have to make sure that the population still has access to healthcare, not just Ebola care.
And on that first point you raised about the importance of working with the communities there, not just parachuting in, how challenging is it to do that in this particular context in the Ituri province that you mentioned, an area where we've seen significant movements of people over the past few years, where we have had active conflict, where there are groups linked with the Islamic State that move around? I mean, how do you build that kind of trust in an environment where there has been so much instability?
This is a great question, and we know that in Ituri there's so many displaced populations. We know that there's so many different armed groups. There's ongoing conflict, and so we need to really put engagement with all different actors in the conflict first. We have to put engagement with the community first. We have to ask them what are their priorities and what are their needs, and we have to make it clear that we're not just there to respond to Ebola. We're also there to look at what their priorities are. I remember in the last outbreak in 2018, 2019, the community was saying to us, our priority is that we have access to water. You tell us to wash our hands, you tell us all these preventive measures, but we don't even have access to water. And so this was key. Once we made access to water for the population, this built trust, and then we're able to move on with the Ebola response. And so this is key. It's something that we need to be keeping in mind.
And on the more medical side of the response here, let's talk about the vaccines then, or in the case of this strain, the lack of vaccine. Is this the kind of thing where a vaccine could be tweaked and found relatively quickly, or are we looking at a response without a vaccine in this particular condition?
So the Bundibugyo strain, which is what this Ebola outbreak has there've only been 3 outbreaks with the Bundibugyo strain. This is the 3rd one. So there's no treatments today. There's no vaccines today. Um, but there are a lot of discussions going on about different studies, different trials that could be done. I don't have the answers right now, but we know that without a vaccine, it's much more difficult, and without any treatments, it's much more difficult.
All right, Trish Newport talking to us there from Doctors Without Borders. Thank you so much.
Thank you.